Assalamu alaikum wa rahmatullahi wa barakatuh. Welcome to the COVID-19 update here live on ITV Networks. It is a Tuesday morning, the 14th day of April 2020, Islamic date being the 20th day of Sha'ban 1441. We hope one and all is in the best of health, inshallah. We ask Allah subhanahu wa ta'ala to protect us, ask Allah subhanahu wa ta'ala to remove all types of difficulties that have been placed upon us, especially with the coronavirus pandemic. Over in South Africa now, over 2,200 confirmed infection cases across the country. We ask Allah subhanahu wa ta'ala to grant full shifa and a speedy recovery to all those affected, inshallah, ameen. On our COVID-19 update, as we have been doing since the day one of lockdown here in South Africa, we've been keeping our viewers informed with what's happening on the ground, different organizations helping and assisting those in need. We've had a medical focus, and then we also touch base with different people of different countries, and also asking what's the condition of the coronavirus pandemic in those certain countries as well. It is day number 19 of the lockdown in South Africa. Remember, it has been extended by another 2 weeks. It's supposed to end on Thursday, day 21, but it has been extended for a further 2 weeks. And you see most countries in the world doing the exact same thing, initially making a lockdown period and then further extending those lockdown periods. You see, Nigeria is one of the latest countries that has extended their lockdown period as well, in the hope of stemming the spread of the coronavirus pandemic. This morning, inshallah, a different focus. So we're going to be talking about youth and how important it is for the youth to get involved, not only when it comes into the coronavirus pandemic, but also in politics. So we're going to be joined via Skype this morning by Sister Fasiha Hassan, who is not a stranger in the activism field, and also she is the youngest MPL member in Gauteng. We are joined via Skype to her this morning. We say Assalamu alaikum wa rahmatullahi wa barakatuh to you, Fasiha, and Jazakallah for joining us on our COVID-19 update.
Wa alaikum salam. Thank you so much for having me, Zahir.
Alhamdulillah. Day number 19 of the lockdown in South Africa. Fasiha, how's the 19 or 18 days of your lockdown been?
So our lockdown's a bit different. We're also part of essential services. So in fact, we've still been working and operating, albeit in a different sense. One of the big things that we've been doing is oversight to kind of make sure the interventions are happening properly. But also, you know, we've had a huge issue with people who are not getting an income. And so we've been doing a lot of work with social development around food packs, food hampers. In fact, maybe your listeners are aware, the Muslim community is really coming to the party in that regard. SANZEF, Operation SA, all of these different organizations are coming together to try and get donations. And it's not just for food, it's also for sanitary packs. And we're making sure this is going to the poorest of the poor. In fact, Zahir, this morning, you'll know, it was initially planned that we were going to make sure there was oversight over the sanitization of taxis. But we were informed late last night, early this morning, that in fact that program was postponed. And tomorrow I'm going to be in Itirileng Township in Pretoria and Swane, also just seeing what kind of needs and what kind of assistance we can provide there.
I see you are on the ground looking at what are the needs of the people on the ground. Before we go on to what activities the MPLs are engaged in the different communities, what are the needs on the ground that you have seen so far?
Right, so it's different, and it's different as per each community. But I think something that crosses all areas. Sanitizers, and it's not just waterless hand sanitizers, it's different sanitary products, because this is a time in which we need to be even more strict on ourselves. Some areas we've had issues with access to water, although in Gauteng this is not as big an issue as it is, for example, in the Eastern Cape, where you're seeing the outrolling of lots of water tanks, for example. I mentioned some of the food packs, but it's interesting because, you know, when children were in schools, particularly in public schools, we have what we call the school nutrition program, which is where they were getting hot meals in the day. Now, because schools are obviously closed for the lockdown and because of COVID-19, a lot of children are also not getting that one meal a day. So that's also forced us to look at different sorts of interventions. And the other thing that we're also doing is we've had to sort of approve the moving around of the budget and money. You know that because we're in a state of disaster, we're not going according to the normal rules, of course, but we do still need to make sure that there's some level of accountability and that government officials are doing what they're meant to do. So, yeah, it's a bit of a mixed batch of work.
Talking about moving around the money, then, Fasiha, what is the most important aspect now with regards to the budget?
Okay, so ordinarily we would have to have a full sitting of Parliament or the legislature to approve full moving around of the budget. And like I said, because we're in a state of disaster, it gives some flexibility. So if there's an emergency need, for example, for ventilators, we are able then to just purchase the ventilators. But it's not just that. I think the biggest thing about the budget is about identifying places where we can take money now because we're in a state of crisis and put it towards the healthcare system, put it towards UIF, and put it towards things that are really needed. So for example, if we were, and I mean, this is just a fictitious example, if we were going to build a bridge in the next 2 to 3 years and money was set aside for that, that money, because we're in such a state of crisis, will now probably be going towards where it needs to go to most. So that's something very important for South Africans to keep in mind. It means the next 2 to 3 years are not going to be normal. Even if we overcome COVID-19 in the next year or so, the next 2 to 3 years, the plans the government has made, the plans that we've made are not going to be on track.
Also, you made mention of intervention programs. And as MPLs, how are you people engaging with the community? How is the community getting involved or in touch with MPLs? And what assistance is being offered to those communities beside food hampers and sanitizers?
Okay, so it's different. Like I said, for different communities, there's some communities where we've had to put in more social workers and more assistance in that regard. We know that there's been, or there's a worry of gender-based violence, of domestic abuse, etc. So that's one of the things that we're also involved in. But even smaller things like ensuring that there's social distancing that's being observed in stores. We do random checks at different supermarkets, at different spaza shops. During the grant payment, we were helping the elderly, those who are differently abled, making sure that they, don't stand in long lines, are able to get their grants. So it really kind of depends at the time in which we find ourselves. So like you said, it's not just about food packs, and also it's around conscientization. So one of the big things that I'm trying to do is when we meet with communities, it's not just about giving them what they need. It's about saying, do you know about the virus? Do you know how it can affect you? Do you know why we have to go through this lockdown? Do you know why we have to do these things? And the other element, but I'm less involved in that, is around enforcement. And that's more the political leadership of like MECs, premiers, their teams, enforcement teams. That's a mixture of police, army, but also CPFs, and just really trying to ensure that people are observing the lockdown. And, we've had some problems with some areas where people have unfortunately not been able to or have not obeyed that lockdown, and there's been need for some intervention there. But of course, one of the jobs we also have is to ensure that there's no police brutality and that there's no undue or unnecessary use of force by the army.
Fasiha, in the communities that you have been in, we're talking about non-adherence to the lockdown. I mean, maybe in the first 7 days, 8 days, there must have been some sort of adherence throughout the entire country. After that, people started getting a bit laxy-daisy. Day number 19, I'm coming to work this morning with a permit, but I've seen the roads are quite busy as normal, I would say, in certain communities. What have you seen with regards to adherence to the lockdown in the communities that you have engaged with?
Some communities have been quite good. And others, and this is also, I think, a socioeconomic thing. You find people just sitting on the side of the road. And, at first I think at first you're frustrated, obviously. There's a reason why there's a lockdown in place. But you also have to put it in context. I'm not saying you must defy the lockdown. By no means am I saying that you must observe it. But when you live in an informal settlement and, you live in a shack and there's really not much going on and you're so many people in one place, you begin to see that there's a much greater context here. That being said, though, I think it's a time for us to sacrifice. It's a time for us to, I think, introspect and say, well, if I don't have to be doing this, let me not. I know some people have been using this opportunity to visit family. I mean, that defeats the purpose. Even if they live down the road from you, right? You could have picked up something at a supermarket. You could have picked up something at a pharmacy. And then now you go and visit your family and they all have it. And I mean, it's small things like that. We don't think they're consequential, but they are consequential. And if we're asking people to not earn an income, we're asking people to sit at home, then we can definitely sacrifice and not go visiting to our friends friends and family, which is something I've seen a little bit in our community happening, and I just want to discourage.
Also, now bringing it closer to home, as the youngest MPL in Gauteng, with regards to the youth involvement, not only in politics, but also with the coronavirus pandemic, what role do you think the youth can play?
So a lot of young people, there's this idea that we are going to be immune from the virus. We're not entirely immune, let's be very clear. But I do think that there's a role for us to play because we are less at risk than other groups. I know I've had activist friends who are actually volunteering at the Disaster Management Center, others who are, for example, volunteering with SANZEF and with the packing of food parcels. Now, not everybody can get involved to that extent, especially during the lockdown, but there's a few things we can do, especially as young people. We can use our social media platforms to make sure that there's no spreading of fake news, that we put across the right information. We can use this opportunity, I think, to plan and to organize for the future. This is, yes, we're in a lockdown, but COVID-19, like I say, is going to be around until there's a vaccine. And we're looking at easily 12 months, which means there are going to be times in which we need to get a little bit more hands-on. And this is also an opportunity for that. And I think the last thing is that it's also an opportunity for us to grow as people. Obviously, you can choose to use the lockdown in any manner that you wish, as long as you're at home and you're observing. But it's an opportunity for us to learn, to grow, and to maybe even start a new project if that's something that you're interested in. I always say you may not be excited to be involved in mainstream politics, but we're all good at something. Find what you love and use that to give back to the community. You know, some people love sport and soccer. You can coach an underprivileged team. You can go and do tutoring over the weekends, for example, during a normal time at an underprivileged school. So there's lots of things that we can do, especially as young people, that I think yeah, I'm hoping we'll be able to do after this COVID-19 crisis.
Hopefully. And finally, a message to more the older people. Let's not leave them out this morning.
Yeah, so COVID-19, we know, is affecting all of us. The older generation is more at risk. So please look after yourself. Please don't take any risks. If there's somebody else who can go out and do what needs to be done, please allow that to happen. But let's use this opportunity to come together as a community, come together as families. I don't think we're going to get an opportunity like this again, maybe in our lifetime, in which we can all just, you know, we have this common enemy, right? Yes, it affects people differently, but across the world, across class boundaries, across racial boundaries, we're all facing the same enemy. And there's many ways and opportunities in which we can come together on it. And I think maybe just a parting shot, I hope that we're all not too frustrated being at home at this time. I think let's try and look at the bright side and the positive side, and let's look at ways in which we can improve. And this goes to any age group, and ways in which we can work together.
Fasiya Hassan, youngest MPL in Gauteng, Jazakallah for joining us this morning and giving us an update of what exactly the members of the provincial legislature are up to during this lockdown period. We wish you and all the members to grow from strength to strength. To remember us in your du'as as well. Assalamu alaikum wa rahmatullahi wa barakatuh.
Wa alaikum salam. Thank you very much.
That was Fasiya Hassan, the youngest member of the MPL in Gauteng, member of the provincial legislature, talking about how they are engaging communities and going on the ground, helping people with regards to food packs, as she made mention, sanitizers, etc. But also a word of caution is that we need to stay at home, inshallah, respect the lockdown period. And inshallah, after the respecting of this lockdown period, we will see better results after the lockdown period has expired, inshallah. Just a reminder to one and all, we are talking about the lockdown period. It is day number 19 of lockdown in South Africa. We know it has been extended. We look around the world. In South America, many countries have extended their lockdown. We look in Europe, many countries have further extended their lockdown. We look at Spain, Italy, countries are talking of extending their lockdown periods till the 11th of May now. So we see every day or every week there is progress being made in certain countries, and then also discussions of whether to extend lockdowns in different countries and communities. So inshallah, Allah subhanahu wa ta'ala knows best. We go for a break, inshallah. When we come back, we'll be privileged to be joined by the Honorable Ambassador Ketumetse Matthews, and she is South Africa's ambassador to Kazakhstan. So we're going to be talking about COVID-19 in that part of the world. Keep watching. Welcome back to our COVID-19 update here on ITV Networks. Once again, being the 14th day of April 2020, as we made mention before at the break, going into different countries of the world, trying to understand the coronavirus pandemic in those specific countries and nations and how they have tried to tackle the coronavirus pandemic. This morning, we are very privileged to be joined by the South African ambassador to Kazakhstan, and that is the Honorable Ambassador Matthews. We say Assalamu alaikum wa rahmatullahi wa barakatuh to you, Madam Ambassador, and Jazakallah for joining us on COVID-19 update here this morning in South African time.
Wa alaikum salam, Zahir. Thank you very much for inviting me onto the program. It's a pleasure to speak to you.
Jazakallah so much for giving us some of your time. Day number 19 of the lockdown in South Africa. What's the lockdown in Kazakhstan at the moment?
Well, Kazakhstan acted fairly early. We had a meeting round about the end of February with the Foreign Ministry where all ambassadors were invited, and they set out to us the program that they would be putting in place going forward. So from around the 1st of March, they had already started working on systematically closing down certain things, certain businesses, airports. They were already taking temperatures of visitors coming into the country. So that was from the 1st of March. On the 15th of March, a full state of emergency was implemented. So we have been under a state of emergency since the 15th of March. It has been extended. It was extended on Friday towards the end of April. And there are also discussions around how long school would stay open because, you know, we're going into the summer. And so normally in Kazakhstan, in the region, due to the weather, the seasons, school closes at the end of May. So the summer holiday, the children are at home for a very long summer holiday to get advantage from the sun, and then the school year starts again in September. At the moment, we're not sure how the school year is going to pan out, whether they're going to keep the children at home till the end of May and then the holidays start, or whether they will open for a short period and then close again. Our sense is that they will probably stay closed, and all the children are being taught via the internet or via video, because, you know, they're fully digitized as a digitized country.
Alhamdulillah. Then talking about the lockdown being extended in Kazakhstan, what are the infections across the country, and are there any confirmed deaths there?
Well, it started fairly slowly, but unfortunately today there were 88 new infections. There are over 1,700 or so, almost 1,800 infections so far. There have been 143 recovered patients, and there have been around, the deaths have not been too bad, but there have been deaths. I think there have been over 20 to 30, over 20 to 30 deaths so far.
When we talk about the lockdown, I know in South Africa, different countries, the citizens respond in a different manner and way. What is the response of the people of Kazakhstan?
Well, you know, the people of Kazakhstan are very disciplined people. They're very, very cultured people. And so it has not been difficult for the authorities here to get support from the citizens. The citizens understand very well about the pandemic. They've been very well educated. And so you don't see people walking around in the streets very much. They were very clear that you will only be allowed out if you need, you know, medicine or special essentials. Most embassies are closed. A few are working part-time, but really, for example, with us as the South African mission, our building is completely closed and locked. So there are no embassies. All our colleagues we share the building with are also not working. They're all working from home. But in terms of the Kazakhstani people, they have been very supportive. They have a very, they're very well educated, so they understand. And they also have a lot of social support from the government. In any event, as a matter of course, they've got a good, social initiatives in the country, and so they've added some additional support, especially for people who are unemployed.
We know in every country, health workers are on the front line. What's the condition of the healthcare facilities in Kazakhstan?
Well, they've got, they've got good facilities in Kazakhstan. Because, since the breakaway from the Soviet Union, they spent a lot of money on infrastructure. They spent a huge amount of money on education. They have a special national scholarship, which is open to all children. And those, the conditions of the scholarship are that you will be sent to the top 100 universities only in the world if you get the scholarship. And on your return, you will work in the public sector for 5 years before you can work. You can leave the public sector and go somewhere else. So they've got a very well-educated public servants, highly educated public servants, multilingual, Korean speaking, Japanese speaking, wherever they went to university. They have that advantage. They also have a big infrastructure program. And so the hospitals are very good. They look good. But on the medical side, I would say that compared to our doctors, they don't earn as much. And many doctors do say that they are forced to leave the sector because the pay is not so good. So that is something that they've said they're working on, to pay doctors and teachers a lot more. I think towards the end of last year, it was announced that there would be increases of up to almost 30% on many of the lower paid professionals. But they're working, at the moment, we're not hearing any complaints from medical doctors. They're very well protected. Even if you see the military who are responsible for some of the sanitation that takes place in the city, they are well protected, with the protective gear as they clean and sanitize. So, I guess if you've got oil money and you use it well, you can do a lot of things.
Very true. Talking about then money, Madam Ambassador, what impact has the COVID-19 pandemic had on the economy of Kazakhstan?
Well, in the last week, there have been discussions on the impact that the pandemic is having on the economy of Kazakhstan, like everywhere else. And I know the president put in some measures last week, especially to protect ordinary people. Every unemployed Kazakhstan person will receive around $100 extra to supplement what they already receive. So poor families, there's a lot of focus on poor families to ensure that they're properly cared for. But in terms of the larger economy, this country is rich in minerals, particularly energy. It's an oil-rich country. It's a gas-rich country. They have a lot of coal, a lot of minerals. They're very blessed, like South Africa, in that respect. And so, for Kazakhstan, what is happening in the oil industry internationally has an enormous impact on the economy. It's about 30% of GDP. So it's a very important sector for the country. And we are watching to see, following the discussions yesterday are around on the OPEC 23 plus. We are watching to see what Kazakhstan's position is going to be further to that meeting that was held yesterday. But if you look at the standard of living here, there are very strong social initiatives that have been taken over the last 25 years. So they have almost met the main SDGs, the United Nations requirements. So they're quite ahead in that respect. But there are also large pockets of poverty that need to be dealt with. And I think the new president, President Tokayev, last year spoke quite clearly about some of the steps that he will be focusing on to really accelerate the social initiatives that were started by President Nazarbayev.
Madam Ambassador, we know you're in a country where it is very cold, not compared to South African weather. Are any South Africans stranded there, and what help has the mission given there to South Africans stranded during the COVID-19 pandemic?
Well, there are not many South Africans here, but those who are here are mainly teaching and also in the oil industry. Chevron SA, formerly it was Chevron SA, Chevron had a joint venture with Tengiz Oil, which is the Kazakh government. And within that venture, there are some South Africans working in the sector. I met some of them earlier this year, and they're very happy. They've got tremendous. They would be an excellent asset to South Africa going forward. They are very, very knowledgeable about the oil sector. Most of them were telling me that those who are in a special project that were here for a short period, I think up until August or so, they were told on Saturday that the project will be suspended. And so it may be that some of them will have to return home earlier than was anticipated. So we have been in touch with those South Africans. We're trying to see whether we can get them on any repatriation that is taking place in Europe, because there are some flights between Kazakhstan and a couple of European countries at the moment, but very specific. For example, there are flights to Amsterdam and there are flights to London. They are very sparse, and unfortunately, we were not able to get any of our South Africans who would have wanted to take advantage of the repatriation that took place from London on Sunday. But for those who are able to get to Amsterdam, they may be able to take advantage of the last flight coming out of Germany. We are working on that. We are not sure whether it will be possible because it depends on whether Netherlands is going to have flights between Netherlands and Germany, Amsterdam and Frankfurt. So it's a very tricky situation, for everybody. Everybody's borders are closed.
Yes.
There are very few flights between countries, and governments are obviously talking to each other about how best to deal with the various citizens in all the different countries. So far, our South African citizens are fine. They're not destitute. They haven't complained around that, but obviously they've indicated to us in the mission that if it is possible for them to go home, then they will be very happy to take advantage of that possibility.
You can make mention to them that winter is also setting here in South Africa, so they should be already well tuned for the winter month. Finally, Madam Ambassador, a message to the viewers of ITV back home here in South Africa, and then also your family back home here.
Thank you very much. Well, this is a very, very cold country. We miss home a lot, and especially from September to around about May, when the temperatures can go up to -40, which for us, is really difficult.
Madam Ambassador, South African Ambassador to Kazakhstan, thank you so much, Jazakallah, for joining us this morning here, South African time. May Allah subhanahu wa ta'ala make it easy for you and your family and the whole mission staff there based in Kazakhstan. Please do remember us in your du'as. Fi amanillah. Assalamu alaikum wa rahmatullahi wa barakatuh.
Wassalamu alaikum, and I would like to pass on my greetings to all South Africans, wish them the best, tell them how proud we are of them and how they have handled the situation. We're very, very proud of our president, and we wish all of you the absolute best that Allah can give you, and may you all be blessed. And may our country be blessed, inshallah.
Ameen, ameen. Thank you so much for joining us. Alhamdulillah, that was the South African Ambassador to Kazakhstan, the Honorable Keitumetse Matthews, joining us this morning live from Kazakhstan via Skype and unpacking the COVID-19 pandemic in Kazakhstan. Also, over 1,700 infections made mention. There are around 30 deaths as well related to the coronavirus pandemic. They are also in a lockdown, as the Honorable Ambassador made mention. They have also extended their lockdown. So this is not a trend or a pattern that is going around in the world. We've seen that lockdowns are being extended. The World Health Organization yesterday stating that it will be detrimental to any country to just lift up a lockdown without lifting up that lockdown in a specific period of time, meaning that any lockdown, if it's going to be lifted, it needs to be lifted very slowly. Otherwise, there's going to be detrimental effects on the population of that country. So many countries taking heed of the World Health Organization's call to either extend the lockdowns and then see how the lockdowns can be lifted at a slow pace or rate. We will see what happens here back home in South Africa. Yeah, watching the COVID-19 update, we've talked about helping communities and helping the underprivileged during this difficult time, in this difficult period that many people are facing because of the COVID-19 pandemic and because of the lockdown. They are not able to leave home and go and earn a living, etc. So inshallah, after the break, we'll be speaking to Maulana Suhail Wadi from the organization called Ashraful Aid, and inshallah he's going to be talking to us about what his organization's response to the COVID-19 pandemic. Keep watching. The ending segment of a COVID-19 update this morning here on ITV Networks. We are speaking to Maulana Suhail Wadi of the Ashraful Aid organization. We say Assalamu alaikum wa rahmatullahi wa barakatuh to you, Maulana Wadi, and Jazakallah for joining us this morning.
Wa alaikum salam wa rahmatullahi wa barakatuh, Brother Zahir and the ITV Networks viewers.
Jazakallah for joining us. Maulana, the response of Ashraful Aid to the COVID-19 pandemic, what has your guys' response been to this pandemic?
So, Alhamdulillah, Ashraful Aid, before the lockdown had happened, had already provided sanitization and education to around 50 public sites. So that was our pre-lockdown. Once the lockdown had started, we had to change our standard operating procedures to incorporate the World Health Organization and the South African Health Department's guidelines. And from the lockdown, thus far, Ashraful Aid has provided around 33,000 meals to those that are desperate and to the most vulnerable in different areas in Gauteng. With that, we have also sanitized the ambulances and fire engines with the City of Johannesburg disaster management. Likewise, we have also provided hampers and food to many vulnerable families around Gauteng. And this will continue right up to Ramadan, inshallah, or till the lockdown ends.
I mean, inshallah. Talking about then providing food and hampers to the most vulnerable, what's the need on the ground that you have seen so far?
So there's a tremendous need for food on the ground. The reality is that there are millions of South Africans, especially those from the townships, those from rural areas, that earn day by day. Some of them are unemployed, and they don't have access they don't have access to food. And the Ashraful Aid humanitarian organization sees this as a major need. Just this morning, there were thousands of people that were promised hampers in Marlborough, and they had come out of their houses by the thousands. They had to be dispersed because someone falsely promised them hampers. So people are desperate. There's a desperate need for food on the ground. We can also understand that it's a very precarious situation because you don't want people to be coming out. You want to protect them from getting the virus. But people that earn on a day-to-day basis haven't been earning for the last few weeks. So it's this balancing act that is needed to provide food for people, especially people that are from the poorest of the poor, and also protecting them from being exposed to get the virus.
Maulana, you made mention of Ramadan. The projects, inshallah, will continue. These the only projects that Ashraful Aid are involved in when it comes to the blessed month of Ramadan, food hampers and parcels, or do you people offer other projects as well?
So most of the projects had to be put on hold, especially our empowerment projects. At this point in time, what we see, because of the lockdown going to be extended into the month of Ramadan, many of our iftar programs, unfortunately, will not be able to take place. So the food program and the sanitization of public sites, hospitals, shelters, this is going to continue right into the month of Ramadan. I understand that many of the countries that we support and the places that we support with our general projects, unfortunately, will not be able to continue because this lockdown that has taken place here in South Africa and many other countries also have lockdown. So your general empowerment projects, upliftment projects will not be able to continue until the lockdown comes to an end. So the greatest need that we see on the ground is the provision of food and food security. So going into the month of Ramadan, I think this will continue, inshallah.
Inshallah. Talking about people getting into touch or into contact with Ashraful Aid, Maulana, how do viewers get in touch with contacting you guys and assisting in delivering food hampers and parcels to those in need?
So the best would be to go onto our website, which is www.ashrafulaid.org. That is www.ashrafulaid, aid.org, to get all our details. If people want to contribute, just part of our distribution, we have also partnered with MINAXA, which is the Masjid and Imams Advisory Council of South Africa, and we've extended financial aid to over 100 imams and muezzins from townships and from rural areas. So this is also a great need because many of them, they get their salaries from shops that are open around them, from the Jummah collections. But this is not possible now with the lockdown. So Ashraful Aid, in conjunction with MINAXA, has also extended financial aid to over 100 imams and muezzins across South Africa as well.
Inshallah. Lastly, Maulana, any words of or a message of inspiration to the viewers of ITV?
The main thing is that we need to reflect on our lives, every person individually. Things have changed for many people, for thousands of people, for millions of people, that a virus which the naked eye cannot see has brought the world to a standstill. So it also makes us realize the greatness of the Almighty, the greatness of Allah subhanahu wa ta'ala. and to realize our insignificance, that a virus that we cannot see, can bring the whole world the whole world to a halt. So it gives us time to reflect on the greatness of Allah subhanahu wa ta'ala. And this is something that all of us, we need to ponder on how great and how magnificent Allah subhanahu wa ta'ala is. And with all this difficulty, there's so much of inspirational stories of people assisting their humanitarian part of their body is now showing. And we've seen how people from all walks of life are giving aid and are coming. Some people don't have anything, but they are giving still. So this humanitarian part of us as Muslims is really coming to the fore. So this is really remarkable, and keep up this good work of being charitable. This is what a Muslim should be.
Inshallah. Maulana Suhail Awadi of the Ashraful Aid Organization, may Allah subhanahu wa ta'ala take you and the organization from strength to strength and keep you and all the staff of Ashraful Aid safe during these difficult times, inshallah. Do remember us in your du'as. Assalamu alaikum wa rahmatullahi wa barakatuh.
Wa alaikum salam wa rahmatullahi wa barakatuh.
That brings us to the end of our COVID-19 update show. Just some words taken there from Maulana with regards to a very precarious situation the world is in. Pakistan's Prime Minister Imran Khan yesterday made mention of this, that the world is in a dilemma. You would find that people are dying of the virus. So how do countries deal with that? Then on the other hand, you find people are dying of hunger and starvation in certain parts of the world. So how do countries then deal with that? So there are two dilemmas at play at the moment, and we need to see how we are going to focus on the remedy of these two dilemmas. So we need to see, inshallah, ask from Allah subhanahu wa ta'ala for help and guidance and His mercy and forgiveness at all times. As we have been speaking from day one of the lockdown, many ulama would make mention of this, that it is a time for reflection, turning back to Allah subhanahu wa ta'ala, inshallah. Do remember us in your du'as from myself and the rest of the COVID-19 update team here. Till tomorrow morning, inshallah, same time, same place. Fi amanillah. Assalamu alaikum wa rahmatullahi wa barakatuh.